Okay, thank you all for joining us for today's expert webinar. I'm going to get us started. Good morning, everyone. I am Jasper, the Communications and Engagement Manager here at the UK Research Integrity Office, and I'm delighted to be your host for today's expert webinar. It's wonderful to see so many of you joining us for what promises to be a very insightful session. We are here today to explore new guidance on non-genuine participants in online research, an increasingly important topic across all areas and disciplines of the research process. As many of you may know, our expert webinar series runs throughout the year, bringing together leading voices to explore current and emerging issues in research integrity. Later this year, we'll be looking at subjects such as ethics in research involving animals, positive research cultures, and whistleblowing in research settings. So do keep an eye out for those future events. As I mentioned, today's session focuses on new guidance developed by a team at the University of Nottingham. Their work addresses the growing challenge of non-genuine participants in online research, from automated bots to false eligibility claims and repeated survey submissions. This issue affects a wide range of disciplines and raises critical questions about data integrity, participant consent, and researcher responsibility, among other things. UKRIO was pleased to contribute to this project as a member of the working group, and we're excited to help share the team's findings with the wider research community today. With that being said, we are joined by members of the University of Nottingham project team who will introduce the guidance, explain how it was developed, and discuss how it can be used to promote good practice and safeguard integrity in online research. To briefly cover our schedule for today's session, the event will run for approximately 60 minutes. You are welcome to join or leave as needed, and registration will remain open throughout, so colleagues can join at any time if they would wish. First, we will begin with a welcome and a short introduction to UKRIO from our CEO, Stephanie Neve. After that, we will move into the presentation of the guidance, which will be led by Dr. Blandine French and Dr. Camilla Babbage from the University of Nottingham. Following that, I will facilitate a Q&A session where Dr. Blandine and Dr. Babbage will answer questions submitted by members of the audience about the guidance. And finally, at around 11, we will bring the session to a close. So, some brief housekeeping before we get started. Today's event is being recorded and will be shared via UKRIO's public channels. This is a webinar, so attendee identities will not be visible or disclosed. Later in the session, we will host a Q&A, as mentioned. If you prefer to remain anonymous during the Q&A, you'll have the option to submit questions anonymously. Just to let you know, because this is a webinar, attendee cameras and microphones will remain off for the duration of the event. Additionally, there are a few functions at the toolbar at the bottom of your screen that will be useful. One is a live transcript. The live transcript is enabled for today's webinar. If you'd like captions of the discussion, you can turn this transcript on or off using the toolbar at the bottom of the screen. Additionally, there is a chat. You feel free to use the chat to share any comments or to say hello to other attendees. You may also directly message the host and panelists to flag any technical issues such as accessibility challenges. UKRIO staff will also be using the chat to provide supplementary information and links related to the presentation as it goes forward. Finally, you will see a dedicated Q&A button at the toolbar at the bottom. Please use this for any questions or comments that you would like to have discussed during the dedicated Q&A session at the end of the webinar. You can submit questions, however, at any time during the session, so as they occur to you during the presentation. And during the dedicated Q&A segment at the end, we will select questions from the pool of those submitted for the University of Nottingham project team to answer live. Please do note that our Q&A, we do ask that you keep all questions submitted to the Q&A to those that are on topic for the content being discussed today. Please refrain from using it as an opportunity to ask questions about specific cases of poor practice you've encountered in your work, or questions of a personal nature. Those matters should be directed instead to our advisory service, where we will be able to give it the right level of support. We'll drop details for the service in the chat later during today's event. More broadly, we ask that all contributions in both the chat and the Q&A remain professional and respectful. So, with all that being said, I am pleased to now welcome Stephanie Neve, Chief Executive Officer of UKRIO, who will start us off by giving a little background on UKRIO and our work.
Thanks, Jasper, and good morning, everyone. For those of you who don't know me, I'm Stephanie, CEO of UKRIO, and I am so pleased you've joined us for today's webinar covering new guidance on non-genuine participants in online research developed, as Jasper said, by a team at the University of Nottingham. Non-genuine participants have increasingly become an issue in online research, and this raises important questions about data integrity, participant consent, and researcher responsibility. And I'm really delighted that today we are joined by Dr. Blandine French and Dr. Camilla Babbage, who will be talking us through the guidance before opening for questions. But before I introduce our speakers properly, I'd like to just take a moment, especially for those who may be new to UKRIO or who just like a quick refresher, to briefly introduce who we are and what we do. So I imagine many of you will already be familiar with UKRIO, but to briefly recap, we are an independent charity that has existed since 2006 to support the research community produce research of the highest integrity, quality, and efficacy. And we do that in a number of ways. So we operate across multiple levels. At the individual level, we provide researchers with accessible, practical advice and guidance. At the organizational level, we help foster collaboration and the sharing of good practice across institutions and sectors. And at the systems level, we act as a thought leader, helping to shape national and international conversations around research integrity. One of our longest standing services, something we've been offering since our founding in 2006, is our confidential advisory service. So every year we respond to a wide range of inquiries, from data fabrication to authorship disputes to questions around research governance. And from the feedback we receive, we know the service is often a real lifeline, both for individuals facing challenging situations, but also for organizations seeking expert independent guidance. But the impact of our advisory service goes beyond those individual cases. So the nature and volume of the inquiries we receive really gives us very unique insight into emerging trends and reoccurring challenges experienced across the sector. And we use that intelligence to then inform the published information and guidance we produce, the training and education we deliver, and the thought leadership we provide. In this way, ensuring our work is really grounded in reality and in practice. So UKRIO publishes a wide range of information guidance in a range of practical formats, from templates, checklists, and model procedures. We also offer an extensive and growing education and training program, including virtual events like today's webinar, but also online courses and live training. We facilitate spaces for the research community to come together, to learn, connect, and collaboratively drive research integrity forward. Really, to find out more, I really encourage you to read our newly published 25-26 work program, which outlines our activities for the year and the many ways you can get involved. Now it's my great pleasure to introduce our two speakers for today's webinar, both joining us from the University of Nottingham. First, we have Dr. Blandine French, a lived experience senior research fellow whose work focuses on improving understanding and support for ADHD in primary care. Among her work includes leading projects like Recount, which explores the personal, societal, and economic costs of undiagnosed ADHD and autism, and developing training for GPs to help improve identification and access to care. Beyond her research, Dr. French is also the founder of the Nottingham Neurodiversity Network and has been facilitating peer support groups for more than 10 years, working closely with parents, children, and young people with neurodevelopmental conditions. I'm also delighted that we're joined by Dr. Camilla Babbage, a research fellow specializing in digital mental health interventions for young people. Dr. Babbage's work centers on co-production and public involvement, ensuring that research and tools are developed with young people, not just for them. And Dr. Babbage leads on a wide range of projects, including a trial to test the digital youth MRC, a game that integrates cognitive behavioral therapy for young people experiencing low mood, co-developing a digital self-harm support tool, and contributing to research exploring engagement, implementation, and healthcare access for people with neurodevelopmental conditions. Blandine, Camilla, it's a real privilege to have you both with us today. And without further ado, over to you.
Thank you, Steph. Shall I just share my screen then?
Yes, please.
Thank you. All right, that was a great introduction. So thank you very much, Steph and Jasper. So as been said, I'm Blandine. I'm a senior research fellow at the University of Nottingham, split between the School of Psychology and Institute of Mental Health. And the reason why we've been asked to talk is we came across this really difficult topic around fraudulent participants, which a couple of years ago I was really naive about and I was completely clueless about. And throughout our research, Camilla and myself, we have come across many different experiences that led us to create guidelines for our institution. And while, the focus is mainly on the guidelines and what we've done and how we did it, we thought it was really important to cover a lot of the background and exactly what is the impact of fraudulent online participations. So I will be spending some time talking about, our experiences here at the University of Nottingham, the different challenges, different strategies, and what to look out for when we talk about fraudulent participation. And then I'm going to hand over to Camilla, who will focus more on the guidelines, how we did it, what we did, and what is leading up to. So how did it start? It started with a master's project that I was running about 2 years ago, when my master's student came up to me and she said, I don't really understand what's going on, Blandine. The data we're getting from our interviews is not what we expected. Now, on this particular project, I was working with adults with lived experience of ADHD and autism, and I've been running support groups for adults for about 15 years. I've spoken to hundreds of adults with this experience. And the interviews went against everything I know. And my entire personal experience or clinical experience working with these groups was not reflected in these interviews, which started, making us think something not quite right. And at the time I was very naive and I thought nobody is going to sit through 45 minutes of interview pretending to have ADHD or autism. And God, I was wrong. So this is the first case studies. We had 8 out of the 12 interviews that we found out were non-genuine participants. We're going to go into details about how we found that out. And then I ended up talking to Camilla and I said, gosh, guess what happened with my project? And Camilla mentioned one of her studies that got completely flooded with non-genuine participants. And then every single researcher I spoke to within our team had some instances of it happening. Whether it was within the context of a randomized control trial, survey, even more recently, PPIE groups, advisory groups, where it keeps happening over and over again. So we published this paper last year highlighting the impact just from one, it's not even one institution. These are all colleagues from the University of Nottingham, but they're all colleagues that we know. They're all our, colleagues we work with closely. And that's already 7 cases out of, God knows how many researchers within the university. And you can see the impact, up to 99% of participants were non-genuine in people trying to take part in research. So this first paper we published just to highlight the different breadth of experiences that we had within our team. And we also published a Lancet Psychiatry paper on just highlighting the issue with that, which we found is really underestimated. I think a lot of people underestimate how often it happens and also the impact that it has in a study. And for us, it had, I mean, weeks wasted when one of our colleagues ran a randomized control trial. Once they found out that there were some issues, going through, sifting through all the participants, all the data, trying to figure out who was a genuine participant and who wasn't. You know, what do you do with the data? What do you exclude? What do you keep? In my personal case, my whole project was cancelled. You know, what should have been a paper and a project for the master's students. We didn't have enough data to publish. We didn't have any funds to carry on recruiting. So a lot of funds wasted, again, just for this one master student. You know, it was £20 per participant, so 20 times 8. It's not a huge amount of money, but when you are relying on that to recruit, it makes a big difference. In the case, we had one study where it happened within the context of a focus group. So it was a focus group for adults with lived experience of self-harm or suicide and autism. Now, there were 5 people with lived experience. 4 of them were non-genuine. So can you imagine the impact this will have on the one extra person that had genuine experience of self-harm and autism, having to disclose very difficult topics within a group of people who are just pretending to have that for most of the time for money. So it can have harm to participants. It can also have harm on researchers when you spend a lot of time, you know, building your research, trying to figure out, you know, you care. For example, this master's project was completely scrapped. But, you know, when it's a randomized control trial, there's millions of pounds invested in that, a lot of time invested. It's really disheartening to think that some people go to that length and how much it messes up your science. It gives you reliable data, and you start losing trust. And I think I can talk on behalf of Camilla and I when I say, you know, as we went through, we do lose trust with participants. You start doubting everyone that comes through. And this is a really nice example from this study that was published a couple of years ago now on the impact of, so lots of people have come to me and say, oh, well, I use Prolific, and Prolific is very secure because every single user is, you know, has been checked. And this was a study on diabetes where they looked at, they asked people if they had diabetes. You said yes or no, you were taken into the study, and then you had to be taken on a certain type of medication. Now, to show that you took this medication, you had to send a picture of the medication that you were taking for diabetes. And when they did, they searched for the pictures to see if they were genuine pictures or if they were pictures that were just downloaded from the internet. And from that, the authenticated images were only 30% from MTurk, which is mainly an American platform, 69 from Prolific, and 73 from Research Match. And that shows the breadth of, even in those kind of safe platforms, the impact of people who will not be genuine and pretend to have a condition that they don't have. But now what I found very interesting in this study is that the difference in reports from the authentic group to the unauthentic group, you know, the non-genuine group were more distress, they had more pain, they had lower quality of life, every single, so these stars show the significant difference between the two groups. Everything was exaggerated. And now if they hadn't captured this, you would have made very strong conclusions, about the impact of this medication and diabetes based on those results. Where actually, when you look at the authentic group, the results are a lot milder and not as significant. So this, for me, really showed the impact of non-genuine participation with, you know, health research, for example. I do have to say there is a difference between health research and general population. So we work with lots of colleagues here in the School of Psychology who do, for example, gambling studies, where bots are a big issue, and capturing a certain type of population is not as much a focus. It's just, you know, what we do general population studies. But when you do health studies and you have people that have to have some kind of criteria in terms of conditions of treatment, the way that the participation happens is slightly different, and I do want to keep that in mind. So when you read around it, so after this happened with my master's students, I went down a rabbit hole on reading everything I could find, every single paper that was published on this. And there are 5 key groups. So there are the bots that I've just talked about, mainly in surveys, in general population surveys, lack of engagement, people that respond, everything in a straight line, again, usually in surveys. Misrepresentations. So these are people that exaggerate experiences or mislead how they fit within certain criteria. So for example, one of my colleagues was looking at people who had experiences of trauma within the last 6 months and the way they interacted with within their work. And now what she found is, the misrepresentation would be, well, you have experienced trauma. Maybe it wasn't in the last 6 months. Maybe it was 3 years ago. Maybe it was 10 years ago. But you think, well, I have this experience, therefore I can take part because I can relate to it and I can just, weave my way through the questions. And that's different from someone faking their lived experience. So in our research, we've had people, you have to have ADHD or be autistic or have experience of self-harm or suicidal thoughts or suicide attempts. And these people haven't got any of these experiences, but pretend to have them to take part in your study. And then the final one is people taking part multiple times, multiple responders, which usually goes with one of the other a group as well. So how bad is it? It used to be just mainly on surveys. You used to think, oh, well, mainly surveys, in those big platforms. But actually, what we found when we started unpicking what was happening within our institutions, it happened in randomized control trial, interviews, qualitative work, focus groups, clinical recruitment, PPI groups. For anyone not familiar with PPI group, these are advisory groups that meet on a regular basis every 2 months. It's usually quite small, 6 to 8 people. So, and you form quite a strong bond with this group. And we had people, taking their experiences, taking part in those groups as well. We had clinical recruitment, so recruitment for clinical trial where you only were recruited through NHS staff, so no public advertisement, no social media, and you still managed to get people seeping through and trying to take part when they didn't meet any of the criteria. So, basically any online studies is at threat of having that happening, no matter how strong your inclusion or exclusion criteria are. And this again is one example of the impact of it when these people recruited mainly through social media, Facebook, MTurk, and personal emails. So as you can see, with the personal emails, out of the 24 they sent, 23 were retained. But every other methods led to so many people being removed for suspicious characteristics or not completing the survey or whatever. And in an original sample of 738, only 117 were retained for analysis. Now, there's lots of different reasons why, but I'm sure you can imagine the amount of time that it will have taken to sift through that. And I mean, it's a lot of manpower to get to that, just for actually very small sample that can be included. And this is, again, another really nice study that was done quite a while ago now, where they deliberately looked at multiple responders. And they ran this survey for a very long time, about just under 2,000 people took part. And then they categorized multiple responders in different categories, from infrequent to persistent to repeaters to hackers. Now, if you look at the hackers, some people, it was between 45 to 67 responses. So the same person responded to that survey 67 times. And it was 34% of the overall responses in the end. So out of 2,000 people, 627 were multiple responders. Whether it's just, oh, you know, I'm just going to do it a couple of times, or but can you imagine 67 times the amount of time that it will take? So I think it's really easy to underestimate how far people will go to take part in our studies, to potentially make some quick money. We will talk about incentives afterwards, but when I went down my rabbit hole of reading every single study that I started to read, just really, I just couldn't believe the impact. You know, when you start looking and you start gauging for these, then you realize actually how far it has gone. So these are other, I won't go into details, but other forms, you know, the ways studies that have highlighted that, you know, some of them up to 80% of the participants were fraudulent. But the only reason I could this slide in is because there's also a couple of studies, which we have seen here at Nottingham as well, where the fraudulent participation was intentional. So for example, there's this one study in Australia, it was something along adoption, I think it was, or social care. And a charity, a group that was against the researchers' values or study of research questions, purposely interfered with the interviews and the surveys to push their own agenda. I mean, this is the exception rather than the norm. But we do have instances, and we had an instance here where people were deliberately taking part in the studies because they wanted to get the intervention, or, you know, it was deliberate fraudulent participation, if that makes sense. So what to look out for? And we're just going to highlight a few of the things that we've seen popping out. 99% of the time, it will be a Gmail account because you can't trace those. And it will be a format of name, surname, and a high number. Not a date of birth, a high number. So, you know, 566 or whatever. Look at mismatched details. So, you know, someone will sign up saying they have ADHD, and then when they take part, they say they have autism, and you're like, well, that just doesn't match, or they give the different date of birth. Are they from the same IP address? That's slightly different and harder to gauge, but something else that some people look at. Ask them to mention where they saw the recruitment, they saw the advert for the study. They usually send quick response. They're usually very concerned about payment, and they're quite short email, short communications. Within surveys, very short response to free text box or empty free text box. They decline to give more details. They decline to be prompted. They decline to give professional details if you want, for example, you're recruiting a very specific professional group. When you can track IP address, you will realize that they usually are in different countries than they disclose. So you have a study that's UK based for people, and then you realize that they are somewhere in Asia or Africa or America, and just look for these inconsistencies and unexpected responses. Again, for my study, you know, it went against everything we knew about the experience of these people in this particular topic. Now, that doesn't mean just because your participants tell you a different story than you expect, it means that they're non-genuine. But usually there will be something that's not quite right, and it's very hard to quantify, you know, what is not quite right. And this is what we see in interviews. You know, it's the same stories. They have vague answers. They can't elaborate on prompts. They refuse to do telephone interviews. They refuse to do a telephone check or a video check. They won't put their video on at any point, and it just doesn't feel right. Now, if you know your topic, you've been working with the same groups for a long time, you will pick it up quite easily. It just doesn't match the experiences or the knowledge that you have. But if it's someone like your master's student or a brand new RA that is not familiar, it will be a lot harder to pick those nuances. It's really hard in interview to figure out what's what. But usually you have this pattern, much shorter time. Similarity in stories for people who take part multiple times. I mean, we had one participant who was putting on stutter and accents but he was saying the same stories multiple times in a row. It's not funny, but the ingenuity behind it all is quite impressive. And in terms of survey, usually you will see your straight line answers, short response time. Again, you can't exclude someone because they spend 5 minutes on a half an hour survey. But it will give you an idea about what's going on here. People just answer the same pattern all the time. Now, we think that, there's loads of different ways that it will be impacted at different stages of the research. And usually what we think about is that you start at ethics, what will happen if, what do I put in place? What do I, how will I mitigate any fake participants in my studies? Now, thinking about it at an ethics application time is really good, because most people realize that data collection or data analysis time, and by that time it's far too late to do anything about it. However, what we've noticed is that often it starts at grant application time. So a lot of the colleagues that have experienced that, have shown that, actually, if you think about it, then you can put some money in place, some resources in place to see what's happening and how to move, and how to mitigate that within your studies. And this is just to demonstrate, like these people put 8 different ways of capturing fake participants within, or frequent participation within their studies. And you can see that all these different, every time they capture someone different. So it's not just one strategy, it's multiple strategies that you have to implement at multiple times to capture different things. And I think that was just a really nice message in that it's not just the one thing. Okay, well, I've done that, or I'll recruit for prolific, and then that's it, and it's safe. It's not. It's just so many different ways that will show how many people are fraudulent in your studies. So do plan ahead, as far ahead as possible. I didn't want to go too much into strategies. So, there are some fantastic papers out there with, the real framework has come up with a really nice framework about what to do around these, whether it's surveys or interviews. So I would highly recommend looking at these to kind of think about, and it will really depends on your studies. Each study will need different strategies. But for me, the key points are, you have to implement strategies at all different stages before you start your data collection, during your data collection, and after your data collection. What are you going to do when you have a huge sample of data you can't use? What do you do while it's happening? When you know that your participant is not genuine, what do you do? Do you pay them? Do you carry on? If they're consented, do you still go ahead? Drafting a protocol is very helpful. And be quite open about what you're going to do within your teams. Have strong inclusion and exclusion criteria at a different stage. Do not advertise on social media, which I know is easier said than done. And constantly check and realize and reassess what's happening, because these people are always 10 steps ahead of us in terms of what we think we've put in place will work, and actually in the end it doesn't work. So even when you put all these things into place, this is an example of social media advertising where after 7 hours, they received 576 responses. Out of the 271 that were eligible, 94.5 were non-genuine. Now, just for the sake of time, I am not going to tell you what happened in my study, but it doesn't matter how long you spend on it. There's still always a very high chance of things happening within your studies. Technology evolves all the time. So when you put something in place, by the time you start your data collection, someone will have thought of some way to counteract it. There's always way to bypass your strategies. So keep that in mind. each tool has pros and cons. By implementing something, you're excluding somebody else, or some people might not approve with some of the strategies that you put through. It's very hard to get them through ethics sometimes. It's not friendly to all groups, especially with certain lived experience. If it's country specific and you want an international sample, there's loads of things to think about. And mainly also, how do you report it? How do you disclose it? Because I haven't read any papers that says, oh, you know what, this is what we did for this, and this is how we mitigated this issue with our online data collection. And what do you do if you haven't planned for it or if it happens? And now this is where I'm handing over to Camilla. So all these things that we had been talking about and thought about as a team led to me working with the ethics committee here at the University of Nottingham. And together with a working group, we developed some institutional guidelines that Camilla will describe in more details.
Right, can you see my screen, Blandine, before you
Yes.
leave? It's all
Yes.
good. Great. So yeah, hi everyone. So my name is Camilla, and I'm just going to quickly talk through what the guidelines look like. I'm just going to give you a brief overview of the guidelines and a bit of a whistle-stop tour so that you can perhaps go away and look at them yourself in more detail if you wish to. But the guidelines were developed with a sort of interdisciplinary group of researchers, including groups from health sciences, psychology, we had ethics specialists with and UKRIO, all part of this to ensure that we put something together that was helpful for researchers, but also thinking about ethics boards that might be able to use this to support our research and make sure that everything we do is with the highest quality. So this is the content. Like I said, you'll be able to go back to this and actually look at the guidelines yourselves. But I think it's quite important to talk about a couple of key points from the content. So when we came together as this working group, we were meeting sort of, I think monthly for about 6 months, and we had to spend quite a bit of time thinking about what the scope of these objectives for the guidelines were. What we didn't want to do was create something that was overly prescriptive that may not actually continue to work, because I think it's really important, and Blandine touched on this, but this is a sort of evolving issue. So we didn't want to be too prescriptive, and we also didn't want to spend time in these guidelines talking about the motivations behind non-genuine involvement. I think that that's for other research papers to perhaps discuss, but it just didn't feel like the most pragmatic use of the guidelines. You know, this is much more about being giving some practical suggestions for what researchers and ethics committees can do to sort of safeguard participants and researchers and ensure that what we do is done in a really professional way. And I think it's also important to add that there are other activities outside of research that we weren't trying to cover in these guidelines. This is very research specific, and not, for example, when you're thinking about lived experience participants, that we know there is difficulties and challenges in that area as well with non-genuine involvement. But yeah, this is very research specific. I'm not going to cover the background very much because Blandine's already done that quite a lot with you, and you can go and read this. But, you know, it was important, I think, that we gave that background in these guidelines so that people could understand what the actual issue was. And a lot of the guidelines were about increasing awareness and understanding for researchers, because I think we feel with that, then researchers can move forward and make decisions about how they are collecting their data and recruiting participants. And as Blandine said, but I don't think we can say this enough, that the potential solutions start as early as possible. So, you know, right at the planning stages. And if you can really think about how you are going to tackle this issue before the issue is potentially impacting your data collection, that's what you must be doing. And you must be doing that as a group to really ensure that you're putting those solutions in place as early as possible and hopefully preventing this where you can. And again, I'm not going to go into the strategies here because Blandine's covered a couple of what they use, but also, like we say, it kind of won't work for everyone. Having a strategy for one research group isn't necessarily going to be the solution, and those strategies are going to have to change over time. But I think part of the guidelines that I feel are really useful is getting people, researchers and ethics committees as well, to consider this. But think about these questions. What are the threats? How would you find out? What can you do before you start collecting the data or recruiting those people? And then if it happens and you start noticing that, what can you do during? And also, how do we make sure that we're not excluding people that are genuine, and making sure that our approach is really professional to that as well. We also actually, I think, included some sort of common situations and then questions to go with that, which I think is helpful and might be worth looking at in the guidelines too. And then another part, and unfortunately, Ali Ashikuri couldn't be here today as he's unwell, but he was going to talk a little bit around how this impacts research ethics committees. And it was so important that our group was made up of also people with ethics and understanding in that area too. And I think that we need to make sure that the kind of countermeasures that we are doing are relevant for that target group that is being sort of researched, and making sure that there isn't unnecessary barriers put in place for those people, but also so protecting people and whilst at the same time making sure that the research does have integrity and that it's not being sort of mismanaged or inappropriately used, especially when we're thinking about public funding. And so to kind of add to that, that what we do must be proportional, and any verification processes that you might put in place, like Blandine mentioned about IP, and that can be challenging. And is that proportional to what we are doing? And also not impacting the experiences of those genuine participants that do want to get involved in research and support what we're doing. And then kind of finally, just making sure that there is transparent documentation of this and everything you do. So going back to that early on in your protocols, making sure that you're saying, and in your ethics documents, that this is how you are going to approach that. If there are people that are potentially needing to be excluded, why you would do that. And then, for those that you have chosen to exclude, that must be reported. And I think it's really important for this field that we do make that really transparent, so that other researchers are kind of maybe being held to account if they are not doing any sort of checks on their participants, but also so that as a group that we are all kind of working together to ensure that our data does have integrity. And you can see the full guidelines at this link here. But I'm going to stop sharing and hopefully get on some of the questions. So.
Thank you so much for that presentation, Blandine and Camilla. As I mentioned earlier in the introduction, we're going to dedicate the last 10 to 15 minutes or so to a Q&A. We have had attendees submit questions throughout the event, and I am very happy to say that it looks like that we have a lot of questions to move through. I will let everyone know from the start that we will not have time to get through all the questions, but we will be sure to address all of the questions in a written summary, which we will circulate after the event, as well as a video recording of the event. And I see there's a lot of interest within the chat for some guidance and references that attendees have been sharing. So we'll take a look at those as well and bundle those into the summary materials, which we will circulate after the event. And I'll go over the details for next steps after we complete this Q&A. So for the purposes of the Q&A, I'm just going to select some questions that have been submitted, and I'm going to put them to both you, Camilla and Blandine, and I'll have you guys decide how you'd like to field them, if that's all right. Perfect. So the one of the first questions submitted asks if we, I think meaning research teams or researchers themselves, check the data, or sorry, can we check the type of data that we are receiving during the data collection process? Is that not considered a form of peaking, so to speak?
I guess it depends on I guess it depends on the study design, which is why we were saying with Camilla, you can't give a set of strategy that will work. It depends if you're doing qualitative or surveys or an RCT. I mean, when you're blinded to your results in an RCT, of course it is. But if you have access to the data, if it's anonymized and you can, then even within the context of an RCT, I would highly recommend having someone, who is unblinded, checking the patterns, because you will see that, you will see, that even if it's different names, the person, having very short time responses, responding the same things and checking that. So, picking, but it depends if you can or not, I guess. And that will depend on your study methodology.
Thank you. So another question submitted is asks, how specific to online studies do you think these issues are? We've occasionally had people sign up to a depressed patient study and healthy volunteer study, both in person in our lab simultaneously. I think some of the same issues were encountered.
So sorry, Carrie, I'm So what we found, I mean, it can happen in person. So in the School of Psychology, when we do a lot of experimental studies, you do have people come who are, not interested and not really doing the studies. It can happen. However, when we started digging into it a bit more, we had this really interesting meeting with Camilla, where, actually the majority of fraudulent participants who make money out of it, like the hackers, the ones that have got a huge drive in taking part in your research, are not from the UK, they're from abroad. So when you track the IP address, they're usually Africa, Asia, or America. So, I mean, being in person would be obviously very hard. And those are the people who make a living out of taking part in research and QuickBooks. So you wouldn't have that impact in the same way. You wouldn't have 90% of participants coming in for it. But that doesn't mean it can't happen in person. It's just a lot more mitigated because of the just accessing the data.
I think as well there was like a question about like how do you know if someone is non-genuine? And when in an online study, it's very, very difficult. That some of this feels like at times that we talked about like a gut feeling, it just feels wrong. Like experienced researchers that have worked in the field, they kind of know when like someone's talking about something that isn't something I've ever encountered before. That symptom is unusual. And then another symptom, well, that's really unusual. And this thing, you're like, this just doesn't feel right anymore. And that's been very, very difficult for us as a group to be like, how does not feeling right actually, what does that look like on paper, like tangibly? But when it's in person, it's much easier to say, hang on, I saw you. Like, and I think that might also be a big difference, a bit like what Blandine's saying. And I know the example given there, you'd be able to kind of maybe pick up on that easier than what is quite a lot of circumstantial evidence that we have to use in online studies. Though I think we'll be seeing this across all studies, methods, methodologies.
Yeah. And I find, even when you do interviews or in person, I think prompting people and really unpicking their experiences really allows you to make a judgment call on whether you think this, because there are some groups. So for example, I work with, an autism group where people are not usually, that they can't explain or they really struggle to explain certain situations. That doesn't mean that they haven't lived it. It just means that certain groups might struggle more with communications than others. But really digging into your knowledge about what is happening and how they fit back into that helps make a decision on those.
We're just going to do one or two more before we wrap up. Another attendee asks, why do non-genuine participants take part in the studies, if not for money?
Usually it's for money. So what we found is that you know, they make a living. That's their livelihood. You know, that's how they earn money. These people are very clever. They're always 10 steps ahead. And when we were talking once with someone that did research in developing countries, she was I remember saying, well, what are they going to do with the £10 Amazon UK voucher? You know, if they don't even live in the UK. And she said, everything can be sold online. And don't underestimate how far £10 goes in different cultures and different countries. You know, £10 for us might just be, you know, an hour of work or half an hour of work. But for other people, there might be a day, you know, there might be food shopping for a week or family. So not only the money goes much further, but it's easy. If you can make, you know, £50 in a day, and that's your weekly salary in 3 hours, the incentive is much higher. So the incentive to take part and to breach through your, you know, your criteria and get in and do it more and more is super high. There was one instance, Camilla, that you had when it was just a prize draw, so the money wasn't super strong. It still happened, but I don't know if you wanted to.
Yeah, that was my experience, was that even with the prize draw, there was people taking part, and the responses, by the way, they didn't feel like a human necessarily doing it either. You know, it was very much like repeated responses of random words that didn't make sense. So I think any incentive around money is a real challenge in this area, and something that I think people should think really carefully about. And I think someone else posted a question about, you know, should we be using money as an incentive going forward if we want the quality of our data to be better? And actually, I think that's something that requires a lot of consideration, and potentially for the field of research you're in, like, does that feel appropriate? Is that okay to do? Would people take part without having any offer of incentive? And actually, I believe personally that a lot of participants that want to get involved do it because they care about the research that's being done. So maybe we do need to think about incentives slightly differently to support this.
I think differently.
I know.
I mean, I just finished a big survey of 900 participants. If I hadn't had any incentive, I wouldn't have got 900 participants. And also, I mean, Camilla and I both work in sensitive topics. You know, when you do a really in-depth interview for an hour talking about self-harm and, you know, very personal, difficult experiences, I think it's right to compensate for people's time. And if you do just rely on people that are keen to make a difference, then you have a very biased sample. I mean, it's a biased sample anyway, but it would be even more, it would just be as much. I mean, there's no way I would have recruited for my study, basically, then. And there are many groups that won't take part without any, which doesn't.
But we can have different incentives. I don't think all the incentives have to be monetary, I think, as well. That's what I'm also thinking. So perhaps.
Yeah, we did think about that. What kind of non-monetary, you know, do you give them training, you know, access to this training that usually is quite expensive? Do you give them, is there other ways? Which I quite like that. Actually, one of my colleagues at the Nottingham Trent did a sleep study, and parents who took part got a free sleep training program that's usually quite expensive and quite hard to get into. And the incentive was really hard for parents, very high. So that's one way. It doesn't work for everyone.
A good question to wrap up the session, I think. But someone asks, are you planning to measure the impact of these guidelines, and if so, how?
Sorry, I'm not. No, that's a very good question. I think Ali is the head of the ethics of R&I and ethics at the University of Nottingham, and he has all the big plans around that, and he's been leading the way the guidelines have been distributed and how they're being used, and we actually quite hands-off on that because we don't have access to any data. We don't know the mailing list has gone to, we don't know how far it's been And I think there was some plan, but I don't really know what has been put in place at an institution to track that, and we don't really have much say over that. But it would be a good idea to have something a bit more, a bit stronger, actually. It's a good question.
Yeah, and for those in attendance, we will make sure to check in with with Ali from the project team to provide any further info on that question as part of the written summary. So with that being said, we are almost at time, so I'm going to bring us to a close. Let me just share my screen again.
I think we can both say we will answer any questions, that our emails are in the chat. Just, even if you have a list of questions, like Jasper said, like just contact us if you want to ask anything.
Okay, so with all that being said, thank you to everyone who shared questions today and their thoughts with us. We hope you found the answers provided helpful, and as mentioned, we will be taking a look at the full set of questions and providing some written summaries for them as well. As we close, I'd like to thank you once again for being part of this event. So following today's session, you will receive a follow-up email tomorrow with a short feedback survey. We greatly value your thoughts on how the session went. And later this week or at the beginning of next week, we will circulate the video recording of the session as well as a summary of the Q&A. And as mentioned, we will collate some of the resources put together in the chat by attendees. When these are circulated, we encourage you to share them as well as the guidelines themselves with colleagues. Quickly before we leave, I just wanted to talk a bit about how you can engage with our work going forward, as well as you will see on the bottom right-hand corner, there's a QR code on the screen. If you scan that with your mobile phone, you'll be able to access the feedback survey that I mentioned a moment ago. So quickly, to get engaged with our work, you can learn more about our activities, projects, and priorities for the upcoming year by exploring our new work program, as Stephanie mentioned earlier in today's event, which was published just earlier this month. You can also be sure to stay connected with us by signing up for our monthly newsletter or following us on LinkedIn. If you would like to receive a notification when the materials for this session drop, they will be published on both of those channels. You can also get involved with some of our upcoming work, including by registering for upcoming events. Our next expert webinar, so the next event in this series, will take place on the 22nd of January. And as mentioned earlier, it'll be focusing on an ethical framework for obtaining materials from sentient animals during the research process. You can find links to explore all of our upcoming events in the chat. We also encourage you to reach out to us via email to explore the benefits of signing your organization up for UKRIO subscription, exploring the possibility of collaborating on future projects, or expressing interest to join our expert community to help shape and inform our work. And you can also get support by directly using our services, including our hub of free public resources hosted on our website, our taught training sessions, and our advisory service, which you can use to seek advice. Apologies if that was a mouthful. But with that being said, I would like to once again thank Dr. French and Dr. Babbage for joining us today. It was a really insightful discussion, and I hope everyone in attendance got some important insights out of that. Thank you all very much. We will be circulating the recordings and all of the summary materials in a few days' time.